welcome to Thrive Together Talks. I know Dana, our executive director, is having a little bit of issues connecting right now. I can see her box on there and it says connecting to audio still. So we will start this off, and I do see beautiful Maria there sitting in her car and dedicated to being with us today. Maria, how are you?
Hey, hi, I'm good. How are you? Long time
Good.
no see.
Oh, I know it's been a while. We're really excited to have you guys on here tonight, and especially having a fellow cancer mama here with us. Um, such a journey that it's been to see Mateo go through everything and to see you be a powerhouse and fighting for him, and not just for him, but advocating for others to do the same, but even on a different level than what we typically teach and educate here at Kick Cancer. But when we want to talk about insurance, we may not think of that as like helping our kid to thrive, but this is a huge aspect in having peace in our home, because this can create a lot of tension, a lot of stress, and the kids feel that from us,
Yeah,
right? And so
definitely.
knowing that you have a little insight on that and some secrets behind the scenes, the ins and outs of that. But first, let me just give you some backgrounds. Besides being an amazing cancer mama, Maria is a human resource specialist with over 15 years of experience in legal and benefits management. Um, so obviously she's had to walk Mateo through this 2.5 years, and he just finished what recently?
He finished in June, yes, yes.
In June. So he just finished in June. Thank God. Um, but Maria also joined Kick Cancer as an advocate for families navigating pediatric cancer during our Childhood Cancer Awareness Month in Florida at her local hospital. Hi, Dana. I finally see you. What an incredible outreach that was. And hopefully it may still continue
And
to.
still
Yes,
is, yes.
and may still continue to open doors for us to reach more childhood cancer families upon diagnosis, not only at that hospital, but possibly give us the tools and the ins to get to other hospitals, because we really want to reach families when they're diagnosed, and hopefully
Yes,
not 2 months down the road or even a year down the road, which is where a lot of families typically find us, is even after the fact. So Dana, hello. Are
Hi
you?
guys. It's so funny. I had like
hi.
two computers. I just got a new computer and so I had it all set up, but for some reason I couldn't get in. So then I got my old one out and then I had to get back on this one because it wasn't working. I don't know what's going on.
Oh,
But I just had a beautiful, the reason I was late is I just had a beautiful conversation with a mama who we just gave her son a kid cancer scholarship. And you know how that is. You get caught up talking to them and then the next thing I know, it's time for our Thrive Talk.
yeah. These are such beautiful connections that we are just honored to have and walk alongside these families. So, um, so Maria, I am going to turn this over to you. I know you have a lot to say, and for any of those who are on right now, feel free to put your questions in the chat while she's discussing, or when she's done talking about all the things, feel free to, unmute yourself and ask away. We want this to be free spirited and just an open communication between moms, or if there's dads that are joining us, and so forth. So go ahead,
Yes.
Maria.
Thank you. So thank you guys. And hi everybody. I think one of the first things that I want to start with is, and we did I did a similar presentation in the Thrive Through Cancer program with
Right.
Season months ago. So I'm using some of that and some additional information because, of course, wouldn't you know that I know a lot about this. I know a lot of people. And when I was going through it, I didn't do anything of it, which is my first point. When, in my experience and what I've seen so far, when your child gets diagnosed, it's obviously a whirlwind of things coming at you all at the same time, and the last thing that you think about in that moment is insurance. but then it also hits you because then the pre-authorization starts to come in or something is not authorized. So in hindsight, I had a person who really helped me through, who's our insurance broker from the company that I work for, who I've been working for the past years, and she's amazing. And once she learned about Mateo and everything, she literally came to the hospital one day and she's like, "Here, this is everything." And I was like, "Oh, I didn't even think about insurance." And again, now looking back at it, I think, how can I help? What can I say? What questions do people normally have? And Dana knows I get these calls. I try to help. I put people in contact. I call myself. So the first thing that I would say is the most important thing to do once you receive this type of diagnosis is, okay, let me look at my insurance. Let me see what's covered. Let me see what's not covered. You're not in a mental position to handle that at the moment. So if you have a friend or a family, uh, a relative that you really trust, because this is delicate information, have them help you. I don't think I could have read through my insurance at the time. So again, if you're in the mental space to do it, you do it. If not, ask for help and really understand what's covered. And then that brings us to two other things. Anyone that's going through a life diagnosis will be assigned a case manager, specifically parents with children going through pediatric cancer diagnosis, or any other type of diagnosis. Insurances have to have case managers assigned to you. I mean, of the amount of people that we talk in Thrive Through Cancer and just other moms that I've met, where they're like, "No, we don't have them." Would they say we don't have them? Yes, you do. You just need to request it. If someone doesn't reach out to you, you have to request a case manager. So that's, again, learn about your insurance or ask somebody to help you review your information, ask for a case manager, and then lastly, talk to your social worker. Social workers are also required by law in the hospitals, and they have a lot of information, from insurance to all the way to can they help or who can help you in your state, like organizations, charities, just groups that will actually help you if something is not covered by your insurance at the time. I know I work with a lot of the social workers when Mateo was hospitalized. Thankfully, my insurance, was really, really good. But there were times where something didn't get authorized right away. They had to come in and help. And again, I know I'm saying a lot. It's just it's a lot of information. But first three steps: know your insurance and understand it. Ask for a case manager and talk to your social worker. Those are my main three initially. And then from there, we can go into another set of things, but those are the main three.
Well, I would say, Maria, for me, it was almost more of like a conquer and divide, right? So there were things that I was taking care of and things that my husband took care of, and he took care of the insurance side. So honestly, when the social worker even walked in the room, amongst all the other people that were walking in, right? It was just this cloud of like,
Yeah.
who are you and what do you do? And she did not explain herself well. Like, I saw her one time and I had no clue what a social worker did. And that was unfortunate. And so, if they can't explain what they do and what they can help you with, find a new social worker. Request
Yes.
another
Yeah.
one, because she did nothing for us, because she's like, "Well, just let me know if you need anything." And I really didn't know what I needed. I didn't know what to.
And it's a shame because they have a wealth of information that they can provide. And that's a good point. If you don't understand something, or if someone is not explaining something well to you, that's why I go back, whether you have a husband, a parent, a friend, a relative there with you, to ask the questions, because your mind is not really capable at that time to do that as a parent. And if you have a social worker, that is the person that you're going to want to go to with questions. They can help, like I said, from anything to paying your electrical bill, your mortgage, to covering medicines or treatment. So that's really important. And it is a shame that in some hospitals, there are, people just working there that are not doing their work to the best of their abilities. But I hope we can change that in the future.
Absolutely. Okay.
Mm.
Well, So I think some of the frequently asked questions that parents are going to have when they're navigating pediatric cancer is, number one, will my child's cancer treatment be covered by insurance?
And that is a great and very important question. And it goes back to, number one, which is get to know what you have. So all insurances are not the same. Insurances are very different. They have different tiers of coverage. And if you have, for example, Medicaid or a state insurance like Obamacare or whatever your state insurance is, that goes into a set of approvals that is known to be delayed because it needs a lot of pre-authorizations, etc., within that field. So in most cases, cancer treatments are covered by the health insurance, including inpatient and outpatient care. But chemotherapy, surgery, anesthesia, and these other add-ons that are considered add-ons to the treatment might need additional pre-authorization or just different levels of requirements. So to answer, is the cancer treatment cover? More than likely, yes, but it could also be that you need to go through a series of steps to get that. Your doctor, your oncologist, and hematologist will give you specific referrals. They'll send that to the plan. They'll work through the hospital. Sometimes these things are not fast enough. I am going to speak from experience. I don't remember what round it was, but I remember that there was a round where we got to the hospital. It was 11 a.m. We didn't think anything of it. We just thought, it was delayed. It was 4 p.m. And they was supposed to start his chemo that day. And we didn't get admitted until very late because the pre-authorization hadn't gone through. Mind you, they didn't know what I worked in. So, I called, and again, I was very blessed to be able to call certain people that could help me. But what about the people that don't have that? Which is why I've become very passionate about advocating for people to know what covers and people to be responsible when it comes to, help anyone that you can with this. So it's essential to know these things. It's essential to ask these questions, and it's essential to understand what's covered, to go back and answer your questions. It should be covered, but you need to understand your policy in order to know if it's fully covered or not. Sometimes you'll need to meet your minimum deductible or your minimum out of pocket, and then it becomes covered. And that's easy with chemo treatments because they're very expensive. And once you reach a certain point, it'll go way over that. So you also should ask those questions. How much is it to meet my maximum out of pocket, my minimum out of pocket, or my deductible, and then go from there. You will meet it, no, without a doubt. You will meet it, and there are, which brings me to my other, sort of point with the hospitals. If you're presented with a bill from a hospital, go talk to your social worker, go talk to the hospital's administrator. They cannot deny you care. That is a state requirement. And if you can pay at that time, you have to be given an option, whether it's a payment plan or some sort of financial arrangement so that treatment is not interrupted.
Yeah. Well, and so that's great if, it's all covered, but what if the insurance actually denies coverage for a specific treatment?
And it happens a lot. Then you go to an appeal. Appeal is going to be, the action of appealing is going to be your best friend during any medical treatment. Oh, I'm so sorry. You go through an appeal, you ask why it was denied, and then you ask what are your options after that. Because it cannot just be, no, thank you. This is not, this is not a knee scratch. This is not a broken wrist. This is a life or death situation. So you go to an appeal, and the way to do it is you call your insurance and you ask them, what is the appeal process? I had, this treatment was just denied. We need it. It's urgent. Your doctor and your hospital are also, should be your allies in this, because if they put pressure and if they call the people that have to call and do what they have to do, then they are able to help you get that moving faster along. They'll probably ask for documentation such as, okay, so why does it need to be approved? We denied it because we don't really think that this is the medicine your kid needs. And then that's when the doctor comes in and says, no, the child does need this medication, so it needs to be approved. So it's a little circle of or a little, just back and forth, which makes everything so slow in a situation where, kids cannot wait for for an approval process or anything like that. But you can ask for an expedited approval. Ask. That is going to be your best, action if anything is denied.
Yeah. And I know that this is the case for, unfortunately, so many of the families that I've come across over the years, as far as not all cancer treatments are actually covered by the insurance, mainly because they're only approved for adults and haven't been approved for kids yet. And so, one of them, for an example, she passed away just a day after she turned 18, and it was incredibly frustrating because they told her the treatment was only available for adults. But so with that, are all cancer treatments covered under insurance policies? I guess would be a question that they would ask then.
Yeah. So generally they're supposed to be, and you just sort of answer the question. Someone was denied, and it resulted in the worst result that you could have, which is death, and it just breaks obviously my heart. But there are, if something is not covered, I already mentioned appeal, and there's also something called an exception process, which is when you ask or request that this uncovered or non-covered treatment be reconsidered. There are also many steps to that, and it's a little complicated, but let's say that they don't approve the fifth round of chemo, or just the rounds of chemo, because like you said, it's either just for adults, it's not approved in that state, whatever the reason is, you appeal. You have your doctor call. They still don't approve it. You then go through that exception process, and that's when the doctors meet the team at the insurance company, the team of doctors, because insurances have teams of doctors. They'll go into the process of reading that exception and understanding the exception. And if that doesn't work, then there's also so many things that you can do, like call your state insurance board, ask them to reconsider. The hospital does the same, your oncologist does the same. So this is why it's very important that, and as I say that, I know that if there are 33 cancer moms here and just other, parents, they're probably looking at me sideways, because it's important that you establish a very good working relationship with your team, your oncologists, your nurse navigators, your case managers, and all of that, because they should be your allies, and they're the people that can really push for you to get these things done.
I think everyone needs a social worker named Maria Mora.
I'm gonna go back and I want to certify.
Like someone who's walked through it and understands and has been there. Like, you would go in there and you'd be super spicy and like, let's do this and this and this, and I'm gonna fight for you this. Anyways, so how
yes, I will.
How can they find out what medical expenses will be covered? Like, if they don't know, how do they find out?
By looking at your insurance policy, like our step number one, by looking at that policy and requesting specific information about coverage. And the best person to explain your coverage is your case manager. The case manager assigned by the insurance, they're supposed to call you over the phone, send you letters, send you emails, call you on a weekly basis, ask you how treatment is going, ask you if you're in need of anything, and explain to you what's covered and what's not. Explain to you why you're going to have to pay a $200 copayment on a Tylenol or something like that. So that's how you know what's covered, and that's how you find out, by understanding the insurance and by calling them and talking to them and requesting to speak to your case manager.
Okay. So let's say though you're not liking either the oncologist or the facility, the hospital, and you decide to change hospitals. Will the child's cancer care be covered if you seek treatment elsewhere?
That's a tricky one. So the answer that I want to give you is yes, of course. Unfortunately, insurances work with in-network and out-of-network. So that is something that is going to greatly depend on that. You're not supposed, like I said, to be denied care. But if your child is in active treatment and the insurance thinks and the hospital think it's risky for you to move your child, that's when you might come into, sort of a wall. So these are things that you really need to talk to your care team about. You can also talk to your case manager about this and let them know, hey, I'm not liking this facility. Is there another in-network facility that can see me? Or is there an out-of-network one? Because insurances have out-of-network coverage, which if you don't know about this, you don't know. And that is really, really important. So to answer your question, they're supposed to, but it's not always an option. So going back, and we go back full circle, having that case manager, having the care team working with you is really important. If it's medically necessary, they should be able to approve a change for you. If it's not medically necessary, then that could prove to be a little challenging.
Yeah. What's interesting is over the years, let's say like, so during treatment, ours was through a clinic. So Riverside Medical Clinic, that was who our insurance was through. That's who we picked for our primary care, but they didn't have cancer treatment for kids. So we had to be referred out, but every time they had to put the referrals through the clinic and then back to the hospital. But then they do the treatment at the hospital, but the insurance would bill us through the clinic's code. And then we'd get a bill for like $10,000. And we're like, wait a minute. And so then my husband had to fight almost every bill because he's like, but they said you're out of network. And he's like, I can't be in network. You don't offer it. So there's a referral. So you have to type in the right code. And they're like, well, what code is that? And he had to do this every single time. And then the worst fight was when she was out of treatment, they no longer allowed the hospital to do her blood draws. They said, because we can do the blood draws, she has to do them here. Well, they didn't have anybody who specialized in pediatrics. And so it was the worst experience every time we went in there for blood draws. It was horrible. And we should have fought more for her, but this is exactly what I'm saying is like, we wanted it at the hospital and they didn't allow it. Like just silly things like checkups, blood draws. But so what is pre-authorization? I know we're just getting to the basics. So some basic questions. What is pre-authorization and do I need it for my child's cancer treatment?
You do need it. A pre-authorization is a requirement from the insurance company where a prior authorization is required in order for treatments or specific processes that are going to happen within that treatment need to be priorly authorized. A group of people need to look at it, need to see if it's medically necessary, and then they need to send that pre-authorization. For example, you need a pre-authorization to be admitted into the hospital. That you have an admission order, it has to go through a specific set of channels, and then it has to be pre-authorized. If you go to a hospital and you don't go through the emergency room, you're not going to get a room at a hospital. You have to go. So that is what a pre-authorization is. It's a requirement from the insurance company to ensure that you go through the proper steps of getting that authorization before you actually get the service. And I'm going to give you a couple of examples. You have an admission date because you're going to your next round, or you're going to get your labs done that day because it's your checkup, whatever it is. And the hospital will send it to the insurance will put it through, and then that day you'll be able to receive the treatment or the service. If they don't do it with the required amount of time, what's going to happen is that the day that you get there, you will not be able to get the treatment, which happens a lot. I saw it a lot. It happened to us a couple of times. I knew what to say, and I knew what to ask, and I knew what to do, and even then it happened. So it's really important, and mind you, these hospitals, and I talk again from my experience, our hospital was amazing, had a couple of hiccups. These are groups of people that work in an office on the phone, on a computer. And if they can get through to yours, they have to go to the next one because this is volume work that they do. And then once they're done with their batches, they have to go at it again. So if someone didn't get to you twice in a day, you're left for the next day. And I'm not saying this in a bad way. I'm talking about it in a more logistical way so that people understand they're not only working your case, they're working your case and probably 200 other cases. So it becomes a volume type of work that it's very hard for one person in the hospital to manage. And then it becomes this, toxic circle of, well, we didn't get to that one. We'll get to it later. Or you didn't get authorized. They did the pre-authorization, when in reality, it's really more resources allocated. If you get the pre-authorization requested in time, it should be done. If there's a delay, you should know. So in other words, a pre-authorization should not be requested same day or the day before unless it's an emergency, because it is going to take time. It has to go through a computer, through a feed, to the system. There are companies that still accept emails and faxes and stuff like that, but they cannot assure you. Again, these are people behind the computer. They're not, the plan decision makers or anything like that. So that's why pre-authorizations are required, and that's why it's important that they're done with time. Which brings me back, when you go, and I hope you guys share this with the people that are still going through this, and we can reshare it and we can just keep talking about it. When you learn about your insurance and your coverage and your policy, one good question to ask is, which of these services, which of these treatments require a pre-authorization, which are not inherently authorized by the plan, which require pre-authorization, so okay, he has or she has chemo on Thursday, so on Monday I have to be, or the Friday before, I have to be calling the plan. Is the pre-authorization authorized? Is it done? Did it go through? Are you requiring anything? And then you keep this log of information that you can definitely give to your team and just have for yourself, because this is what's going to help you make sure that there are no delays.
Wow. Yeah, I would say this is like the medical politics of it all that then causes delay of treatment, which is infuriating. This is your child's life that's on the line, and the oncologist is persistent in saying we need to stay on track. We need to, continue to break down the tumor and to only have this much time in between and so forth. So it's incredibly frustrating to learn that this is just the system, the politics of medicine. Okay. Let's see. What are some options if the insurance doesn't cover the medications and treatments? So we have a lot of parents that are having to go on single income and everything else, because you've got to have one parent with the kid. Now you've gone from dual income to single income. Like, what are some other options?
Great question. Appealing is your first option because the medicine is required for the treatment or because of the treatment. As financial assistance from the hospital, your social worker has, again, a wealth of information to give you financial assistance information from the hospital, organization, charities, you name it, they should have it. And then lastly, there are patient assistance programs that exist in all of the states, and then also that are non-related to the state, but are like local, because a mom set up a group of people. So appealing, requesting information from your social worker, and patient assistance programs. There are also, I'll never forget this. One day, Mateo wasn't authorized something, and it was like a $200 injection or something. Don't ask me the name because I forget, and I was like, I'll pay for it. Like, I'll like, we're not gonna delay it, we'll pay for it. I remember like my mom was like furious. And then my oncologist took my phone and she's like, no, you're not gonna pay for it. And she downloaded an app, like the RX app, those cards that you see in the pharmacy. And she's like, requested through there. So just researching, I think we all research when anything like this happens to us. We go crazy researching because we just want to do what's best and everything to the best of our abilities. So if you research, you'll find more things. But as it pertains to insurance, the appealing process, the assistance program, and then financial assistance from the hospital, which is your social worker should have.
Okay. And if you have your primary insurance, if you're getting assistance with, medication costs and anything else, What about secondary insurance policies? A lot of people
Yes.
don't.
Supplemental insurance or secondary insurances are very good to have. If your primary one is not covering something, you can find out, and you can find out through your insurance, is there a secondary or a supplemental insurance that I can add onto my plan? You can call the state, you can ask your social worker, you can ask your case managers, you can research online. And what this will do is that they'll kick in once the primary doesn't cover anymore. Sometimes emergency room visit, anesthesia, stuff like that, they'll cover. And however, hospitals are very, I don't know what word to use, mindful, let's use that word, even though it doesn't really apply. They need to know when you have one or two insurances because they need to run the charges through both and see which one will approve first. So it's important that if you have two insurances, you let your hospital and your care team know, because you're going to be fully covered. Whereas if you just say that you have one and then all of a sudden you're like, hey, I also have this one, it might cause, that really might cause certain delays for certain things, unless you're just adding it at that point in time.
Yeah. So even with primary medications, possible secondary, if they still can't manage their medical bills afterwards, what then?
So many things. Financial assistance, payment plans. That's when GoFundMe comes into play because it really works. Organizations, charities, your social workers. They have this, and I go back to the social workers because they're an amazing resource. They already have those organizations within the hospital to specifically help there in your hospitals. These are people that are constantly collecting money from donors, from just families that want to donate, and they will have these things for you. They will have gift cards from Publix, from Target, from wherever you need, you name it, they have it. Like I said before, they'll be able to help you pay your, your electric bill, your car payments. Some will even go to the extent of mortgage payments and help you pay for this. But when it comes to specifically medical bills, things that I'll say, and this is, I recently got a bill. So I was like, oh, so read the bill. Make sure that you require an explanation of bills from the hospital where you see in detail what they're charging you. Because like I said before, Tylenol doesn't cost $200. So it's important that you look at those charges and you see what it is that they're charging you so that you can then sort of like checklist what you're being charged. Okay, why are you charging me $200 for Tylenol? Let's make sure that we fix that. Why are you, and you don't need to be an insurance expert or anything like that. That's when the social workers come in. That's when the financial department comes in, a friend, a family member, or your case manager. Explain to me the items and just go, why do I have to pay $30,000? Why do I have to pay $2,000? So on and so forth.
Yeah, and I know Dana popped in there, like, I know this can be overwhelming. Is there any, questions that you guys have? I'm sitting here and I'm thinking about, obviously I had my husband to kick all this stuff on. But what about our single moms that are out there that they have to manage everything, trying to, there's a mom who's trying to manage a full-time job, other kids, and having to leave their kid at hospital during cancer treatment so that she can go to work that day and still trying to manage.
And not lose the insurance.
Yeah, you can't lose the insurance coverage. Like, it's absolutely ridiculous. And
I saw a lot of those and I was like brought to tears by that, seeing kids on their own because their parents had to go work.
Yeah. We had a kid next to us. She was 14 and Paisley was 3 at the time. So we would constantly go over there and visit her and hang out with her because her mom was always gone. And she's like, it's okay. It's always like this. It's like, but we would, anyways, that was squirrel moment. So getting back on, besides the, charity care discounts and so forth, are there other resources available that can help when parents are just overwhelmed and don't know how to manage it?
Yes. Nonprofit organizations, There are hospital financial counselors that should be available and that your social worker, if they're aware that your experience in financial trouble, should connect you with. And then there are state and local programs, specifically if you are covered through Medicaid or through a state insurance, that are there. They exist for the solely purpose of helping you through medical, just payments, stuff like that. And that's why, again, it's important for you to understand what is covered, what's not covered, who can help you, who can answer your questions, so on and so forth.
Well, what if during treatment your insurance plan changes?
Yeah, another tricky one. So if that happens, there's a couple of things that need to happen. The facility, the hospital needs to be informed right away. The care team needs to be informed right away. And because you don't want that to be an interruption of services, because they can find you anywhere and they can basically find your information. So reasons why coverage would change. Life qualifying events such a divorce, loss of job, the plan goes out of business, which is a very exaggerated, but still potential thing that could happen. When you're selecting that new plan, or when a new plan is given to you, your first question is going to be, does this cover this treatment that my child is currently under? Because it will be considered a pre-existing condition, and again, a life and death one, they're not supposed to deny you. Again, it's not like it's not painkiller for a surgery that you had years ago. This is a life and death situation, so they're not supposed to deny you. So two things: you inform your care team in the hospital, you inform your oncologist, and then you ask the new plan what's covered, and you go through the same process all over again, understanding what's covered, what's not covered, etc. But there should not be a delay in treatment because there is no coverage. There are those other options that we just discussed are there exactly for that.
I'm glad that you brought up pre-existing conditions, because I was actually going to ask that. We're obviously well into survivorship, but even in survivorship, you have this issue coming up, whereas my husband is going to be retiring and it's only a California-based insurance. So when we switch, we're going to have to switch insurance companies. And I'm like, but she's got a pre-existing condition. Are we going to be denied? So now obviously she's not in treatment, so this actually could be an issue though, right? Even in survivorship.
Yes and no, but more than likely, and I know I think we've talked about this before. Whenever you go either insurance shopping or when you're giving the insurance, you need to have these conversations ahead of time, because these are things that you're gonna have to, let's say that they say no, unfortunately, if she needs another treatment, it's not gonna be covered. No, we're appealing that even before we get into this, because you cannot really have that as an option. That's not an option for you or for anybody. So if you have a pre-existing condition related to cancer, it's important to look for a plan, or to let the plan know that there's a very specific pre-existing condition and that you need specific coverage, so that they offer you options that will actually cover that. Pre-existing conditions that are not life-threatening are a completely different story. But again, this is a life and death situation. Even in survivorship, God bless, all of us and the kids, and that doesn't happen. So you have to consider the what ifs when it comes to this, because you cannot just be left out, in the dark if a situation comes up. And I've also heard about a lot of people that it's not that they're in remission and the cancer comes back. That's not it. It's more like they got sick. So the sickness is different, because as we know, these kids, their bodies are not going to be the same. Going through this battery of tests now, it's a completely different thing. It's not like just going to pull, regular labs. You have to do labs, and you have to do scans and all of it. So it's important to know that all of these things are covered.
I don't know if you've ever had this question before, and I got into this conversation with someone else just last week, which is saying, what they would have to pay in insurance if they filed it through their insurance was way more than if they just offered to pay cash.
Yeah.
Kind of thing.
Yes, I've heard it. I haven't had the experience of it myself, but I did recently. So let me see how I say it without compromising anybody. An oncologist that I know, that's what I'm gonna say, called me, and this oncologist was like, "This mom's not being authorized. This, help her. Like, can you help her today? Because we need, like, she's trying." And I'm like, "I'm on it, and I'm trying, and I'm calling the state, and I'm calling the insurance. Mind you, I cannot represent, you know, anybody. So I'm just asking certain questions, calling the people that I know. Um, it might be a possibility that in certain states it's cheaper to pay out of pocket than to actually go through the insurance, because again, you're going through an insurance that is going to bill the hospital, bill for the service, bill for the medicine, and then go back in. And if it's an out of pocket, it could be that it's very simple. It's 1, 2, you're paying directly. So yes, it doesn't surprise me at all. I haven't, gone through it myself, but this one that I'm talking about ended up paying out of pocket, because even though we tried anything and everything in the book, outside of the book, we got really creative. She was, and her reason, like what she needed to do, she needed to go out of state for a treatment that wasn't offered in her state, but it wasn't deemed medically necessary by the insurance. So she ended up just going and paying out of pocket.
I find when they say not medically necessary, see, and this is frustrating too, because I've also heard that with the Affordable Care Act, that there are some even preventative services that are available and should be offered, even in survivorship. Like, these are things that our parents need to know as far as preventative services for our
Yes. And with the Affordable Care Act, there are a lot of things that people aren't. Again, if you don't know, you don't know what you don't know. And these are not things that were, let me see what the ACA covers. No. When there are things that are preventative care that are there, and there are things that even as you start going through treatment are covered, but you're getting billed for it. So it's important to just, again, I went through it. I don't wish this upon absolutely anybody. You have to inform yourself, and you have to like dig deep, ask the questions, become that annoying person that will not take no for an answer, and just try to get those things for your child in order for them to be covered. When it comes to preventative care specifically for there are things that I'm sure that I'm going to do with Mateo that will fall under preventative care. And because he had this, I would have to wait 2 years, which is, that remission period, in order for it to be considered preventative. If not, they'll deem it medically unnecessary, and they won't approve it for me to get it done. So guess what I'm going to do? I'm probably going to try and pay out of pocket for it, or see if there's an organization that could help me pay for it, which I'm sure I'll find and they'll do. But you see, these are all of these loopholes that when we're going through this, we're not in the mental space to be able to think of these things, but it's so important. And I want to be, you guys know, Dana knows, Shannon, you call me, we'll connect you with whoever we need to, because we need more of this. We need the support in the communities where we have parents going through this with their children. I recently was watching, which is not pediatric related, but I have a friend of mine who is in remission. She's an adult. Let's say that she's over 30, and she still needs to get testing done. She recently had to have radiotherapy because they found, a little bit of something somewhere in her body, and it was kind of like 2 rounds, something very short. Now her insurance is denying coverage, and she's going through this uphill battle of, what are you talking about? Like, what is happening? And she's posting, she's being very vocal, she's tagging the plans, she's talking to people, and it's become a thing because people are waking up to this, where it's like, wait, this is not right. We need to do something about it. We need to make sure that if there's some sort of an injustice is, you know, taken care of. And these are those things that we need to be there for the parents and the kids and everything else.
Yeah. Well, if there's anything that you guys can take away from this today is, I think the biggest thing is making sure that you and your social worker are on the same page. And if not, meaning they know what to do, they know how to make you feel comfortable and carry you and walk you through this, making sure that they take care of you every step of the way, all the things that you don't understand, all the things that you don't know, that they're going to fight for you. Because if they're just sitting back in their chair and they come in and they shake your hand and I'm your social worker, nice to meet you, I've read Paisley's chart, okay, if you need anything, have a nice day, like they did for me, you get a new one because they literally
Awesome.
did nothing for me. And my husband had to fight tooth and nail. And I just was like, thank you for taking care of that. And if it's not your social worker, then find yourself a spicy Maria um, who can go over all your bills for you. Not this one. I'm not saying like everybody call Maria, but like find yourself a spicy Maria that can just be there for you and fight your battles, because this is not something that you should have to worry about. The medical politics of all of this, and being, you're already in this massive traumatic experience and the weight that you're carrying is so heavy anyways. This should not be something that our medical industry is putting on you, especially during this time. So I pray for all you families right now and what you're dealing with. And that you can find peace and hopefully a great social worker. Maria, thank you for being on tonight. Thank you so
Thank
much.
you guys. Thank you, thank you, thank you. I'm hoping that we have another one with where we can update people. You know, we're looking to see some changes coming soon potentially, and I hope that those are favorable changes. And I'm not speaking politically, I'm speaking, you know, in terms of real change. So hopefully the next time we have one of these talks, it's going to be with positive information for everybody. But definitely ask the questions, ask the people what they can do for you. Like you said, if your social worker is just introducing herself, sit her back down and tell her, okay, bring me all of the paperwork, bring me everything that you have. Just make sure that you are asking those questions and asking for help.
Yeah. And if anybody who's on this call has a question, please voice it now. Do you have any questions? Otherwise, I think I'm going to turn this over to Dana. Dana, did you have any announcements for us? Maybe what's coming up next?
I didn't get to hear the introduction, but I'm sure it was lovely. I just want to tell you, Maria, I miss your face and we need to catch up soon, but I'm just so grateful
I
for your
know.
knowledge and your advocacy. And as I sit here and watch the two of you, it was so funny because I had this moment where I I just am inspired by both of you because I think about like my sister's journey through ALS. And sometimes when I have somebody call me, because I do mentor people, sometimes I'm like, it's exhausting, and I think it's because it's still so triggering because I'm so close to that. And I just want to tell you both that I just think it's amazing that you've both gone through this, you've gotten the clean bill of health, but that you're so dedicated to other families that are going through this, that you're not shutting the door on that part of your life. And it's probably because it never really fully goes away, it becomes a part of you, like that experience. But I mean, it would have been so easy for you both to be like, yay, my kid's okay. See you later, cancer. But instead, you guys decided to dive into this, and I just think it's very admirable. And we're just really grateful to have you guys a part of this community. So,
Thank you. Thank you. I don't think for me, it doesn't, I don't think it'll ever go away. If there was a reason,
yeah,
this might be it.
yep.
Well, I actually, I prayed and asked God if that was it and he was going to take me out just over a year ago. And then I got a phone call from Season. So, and
And here you are.
here I am. So I'm
Oh,
not done. I'm not done yet.
well,
So,
yes, reach out to us if you guys have questions. I know it's the holiday, so we didn't have quite as many people, but a lot of people have asked me already if this is going to be on our YouTube channel. so that they can watch it, which it will be. So I will get that up this week so that anybody can rewatch it. And the only announcement I have is tomorrow we kick off our 12 days of kick cancer. So I wonder if I can, this new computer I got, like the Zoom is crazy, but I was gonna share with you guys.
All of our donors are coming in hot with prizes and
Yeah.
discounts for anybody. So if you can tune in on the live, you're probably more likely to get in on what's going down.
For
So
sure.
yeah.
Yep,
So
tomorrow we are going to, as long as Season's internet works in Mexico, she will be talking to our team over at Queen of Thrones. So we will be meeting with them on Instagram tomorrow at 11 a.m. Pacific time, 2 p.m. Eastern time. We're going to meet with a couple people from their team to talk all about their wonderful products and how we use them in our cancer kits. And then the next day, we are going to talk with Leslie, who is a guru about all things doTERRA. So all those oils that are in your kits, she's going to help us make sense of them all and cover all that. But we have 12 days in store for you. And yeah, lots of fun giveaways, fun conversations, and hopefully we raise some funds because we need it. And this is our big end of the year campaign that we are hoping to raise $50,000, and we have a long ways to go, but we still have a few weeks to get there. So please spread the word, and we'll see you this
yes,
week.
and then put us on your calendar for January, Thrive Together Talks as well, which I believe
Yep.
is Hillary Boynton from School of Lunch.
I believe so, yes.
Healthy, nutrient dense meals. I love her so much. She's amazing. So hope to catch you guys next month as well.
Great. Have a good night,
Very
everyone. Maria,
excited.
thank you. Shannon, thank you.
Bye, guys. Thank you, everybody. Bye.